1 in 14 hospitalized patients has an infection acquired during their treatment in the hospital. Each year, 4.3 million patients in hospitals in the EU-EEA acquire at least one healthcare-associated infection during their stay in the hospital. Up to half of healthcare-associated infections are preventable. Patients can get an infection from another patient or from the hands of the staff that are taking care of them. The infections can also be acquired through the use of medical devices or from the hospital environment. The most common infections are respiratory tract infections, including pneumonia and healthcare-associated COVID-19, urinary tract infections, surgical site infections, bloodstream infections, and gastrointestinal infections. Anyone getting medical care is at risk of a healthcare-associated infection. However, for some people, the consequences can be much more severe. Very young people, including premature babies and very sick children. Elderly people who are frail and have weaker immune systems. People with certain medical conditions, such as diabetes and the immunocompromised. These infections often have serious consequences and can sometimes lead to death. There are simple steps that can be taken to prevent infections, such as keeping hands clean, both healthcare staff, patients, and visitors. Providing alcohol-based hand sanitizer at the bedside. Hospitals can take more complex steps, such as placing patients with infectious diseases in single-bed rooms. Regularly training staff in infection prevention and control. Regularly monitoring for infections. ECDC gives hospitals advice, tools, and information to help them prevent and control infections that occur in healthcare settings across Europe. ECDC also works with national health authorities to improve infection monitoring and encourage good practices in healthcare facilities. You can find out more about healthcare-associated infections at ecdc.europa.eu.